Okay, cardiovascular system, part 3. What we're going to focus on first is blood pressure. So first, how is blood pressure defined? It's basically the pressure of circulating blood on the walls of the vessels or large arteries of the systemic circulation, usually measured at the brachial artery. So when our left ventricle contracts, that's going to force blood exerted on the inner walls of those vessels. We can measure that best at the brachial artery, which is very close to the pumping action of the heart. Pressure is highest in our arteries and lowest in our veins. We'll discuss why that is on the next slide. Something else to keep in mind is the difference between systolic and diastolic pressure. Systolic pressure is higher because that's when the ventricles are contracting. So pressure is going to be greater in the ventricles during that time compared to diastolic pressure, which is when the ventricles are relaxed. It's when they're filling with blood. So it makes sense that the diastolic pressure would be lower. We can see that in the chart below. We see systolic pressure less than 120 measured in millimeters of mercury is going to be considered normal. And then we look at diastolic pressure, less than 80 millimeters of mercury is considered to be normal as well. So with this, we see all the numbers in the systolic column are going to be greater than the numbers in the diastolic column. So systolic pressure is actually a more important or a better indicator of heart function because it basically tells you how much pressure there is in the ventricles when they are contracting, ejecting with blood. If there's too much pressure, we may have a reduced blood flow or a decreased stroke volume. Compared to if there's less pressure, then we're going to have an increased stroke volume. More blood is able to be pumped out because there's a less of a resistance. Also, this chart at the bottom, you don't have to remember or memorize this chart for the purposes of exercise physiology. You'll learn more about this chart in applied exphys and testing and prescription. So let's talk about systolic blood pressure versus diastolic. We already said systolic is going to be the highest pressure occurring during systole, which is the contraction phase. Diastolic is the lower pressure during diastole, or the relaxation phase, the filling of the ventricles. What we want to look at in this picture here is venous versus arterial pressure. We want to understand which one of these is going to be higher. And it's probably pretty obvious that arterial pressure is higher than venous pressure. So let's look at this kind of graph down here. We have millimeters of mercury over here. This is looking at the blood pressure. So pulse pressure is the difference between systolic and diastolic pressure. We see diastolic is 80 millimeters of mercury. We see systolic is 120 in this diagram here. We have another word we want to define is mean arterial pressure. This is the pressure that propels blood to tissues in the cardiac cycle. So it's the average pressures in the arteries over time. And that's what this dark line here is referring to. But really all we kind of care about is systolic versus diastolic, specifically looking at arterial versus venous. So arterial pressure kind of starts with the blood being pumped out of the aorta. So if it's being pumped out of the aorta, we know it's going to the body. It's then going to travel into the elastic arteries down to the muscular arteries. So all through kind of this part right here, we see blood pressure is still extremely high, has the same values it did right when it left the heart or out of the aorta. But then you see as we start to travel into the arterioles, which is our branches of the arteries, we see that that pressure then starts to decrease, and then a very rapid decrease as it travels into the capillaries. So this is like the capillary beds in an organ or in a muscle. And then we see as it moves through the venules, which are the smaller branches of veins, and then back into the veins and then through the vena cava, we see that pressure is very low. So kind of the answer here is that venous pressure much lower than arterial due to the loss of pressure as blood passes through capillaries. Venous pressure is furthest away from the pumping action of the left ventricles. low in capillaries, but high enough to exert a little bit of pressure and deliver blood. So next point we want to look at is an increase in cardiac output. Is that going to increase blood pressure? So yes, they are equal to each other. If we have an increase in cardiac output, we have more blood ejected into an artery per minute. That's going to increase blood inside a fixed space. And if we have more blood inside a small area, that's going to increase pressure, specifically our blood pressure. With exercise, we have increased elasticity and compliance of our peripheral arteries. This will decrease blood pressure, allows them to expand when blood is ejected into them. This will help prevent atherosclerosis kind of later on with life. This is seen with endurance training, not resistance training. But endurance training, we do see very positive changes to the elasticity and compliance of our arteries. Here's a quick video on blood pressure. To this lecture. We want to now discuss laws governing blood flow. So blood flow is based on the relationship between a change in pressure and resistance experienced. We see that blood flows from areas of high pressure to areas of lower pressure. So the highest pressure is in the aorta, like we can see here at the bottom. Now that pressure is going to flow to lower areas, so throughout the arteries, into the arterioles, and the capillaries where pressure is lowest. This is the circulatory nature of blood flow in the body, and most things in the body. We'll talk about in chapter 7, airflow, and how air also flows from high areas of pressure to lower areas of pressure. So let's discuss now what are some factors that will increase blood flow or decrease blood flow. So first we want to look at rate of flow is proportional to pressure. So if there's an increased pressure difference, we're going to have an increase in blood flow. So let's give an example of increased pressure differences. So we could take the pressure difference between two locations. So between the ends of a vessel. So we could take the front end of a vessel and kind of the end of a vessel. If one area is higher than the other, and if we amplify that difference in pressures, we're going to have increased blood flow. So increased pressure difference. We could also look at the pressure difference between two chambers. So the difference of the pressure in the atria compared to the ventricle. The blood flows from the atria through the valve into the ventricle. So there was a higher pressure when the blood was in the atria, and it flowed to the ventricle because at that time there was a lower pressure there. So if there's an amplified or a magnified difference in pressure, we're going to have an increase in blood flow. The second factor has to do with resistance. So we see this picture down here. This triangle means change in. And so we have a change in pressure, which we see right here, and then we have resistance to flow. So that's basically what flow equals, or greater amounts of flow. It has to do with both of these factors. And this one's kind of obvious. If we have a decreased resistance, we're going to have an increase in flow. So think of blood pressure. With blood pressure, there's greater resistances there causing that pressure. Let's say the artery is constricted, or there's a plaque buildup. There's going to be that's a resistance there. So if we have an increased resistance, we have a decreased flow. But this, I guess, example here shows we have a decreased resistance. So let's say we have a healthy person who exercises, they have no plaque buildup, and their arteries are very compliant and elastic. So decreased resistance is going to equal increased blood flow. So resistance is encountered when blood experiences friction. What's friction due to? It's either due to vasoconstriction, so the constriction of an artery or of a vein, or of some sort of plaque buildup. So that causes friction against that blood, and if we have a resistance, we have less blood flow. So kind of just like we explained on the last slide. But now let's talk about how can resistance to flow be changed? So we'll list a few variables here, and I'll give some examples. First is length of the vessel. So think about, when does the length of the vessel, and this is talking about just an artery, when does that length actually change? It only changes during growth. So think about growing from a child to an adult. Your vessels are lengthening, they're getting longer. Longer vessels equal greater resistance because now the blood has to travel further. So in smaller children, they have lower blood pressures due to the smaller length of the vessels. But as we age, as our body lengthens, that pressure increases because that resistance is now greater, and that's going to decrease our blood flow. Next is radius of the vessel. Radius is referring to diameter of the vessel. So what causes changes to the radius? So anytime we are exercising, to some organs or tissues will have vasoconstriction. So vasoconstriction would be a decreased diameter. If we decrease the diameter by half, blood flow will also decrease, but by about 16 times. But let's say we're exercising and we want greater blood flow to our muscles. Our muscles will vasodilate rather than vasoconstrict. And in the vasodilation, we have a greater diameter. There's also a greater radius there. So with that greater radius, we have greater blood flow. And then last is viscosity of the blood. Blood viscosity is just talking about the thickness of the blood. How thick is it? If viscosity increases, we'll have a decrease in blood flow because now there's more friction there. So more friction of that blood to flow through the arteries. It's thicker. It doesn't move as quickly. So when does our blood change in viscosity? It changes slightly from rest to exercise, so just slightly. And then also it's kind of due to sweat. Loss of fluids will increase blood viscosity, and then just dehydration. So if we're dehydrated, it means we're lacking that watery component in our blood. And if we're lacking that watery component, that plasma volume decreases, meaning the blood viscosity will increase. So make sure you are drinking water to make sure that we don't have too much resistance on our vessels just because we have an increased viscosity. All right, so next looking at oxygen delivery to a tissue and how blood flow changes and allows this delivery. So let's talk about during exercise. We see our statement up here, blood flow increases. Why does blood flow increase? We already talked about the changes occurring at our heart and how stroke volume increases with exercise. And this allows for increased nutrient delivery, so oxygen, fuel sources, and then the removal of waste products like CO2, hydrogen ions, and lactate. So what does oxygen delivery depend on? The amount of blood flowing through a tissue. So at rest, blood flow and oxygen removal remain relatively constant. So we don't need extra oxygen delivery to our muscles at rest. So the amount of blood flowing to a tissue and oxygen being delivered, if we're at rest, that's not going to change much. But as we start exercising, we have increased blood flow. This is called redistribution of blood, and we'll discuss that, I think, kind of in the next video. But the second factor is oxygen delivery depends on the amount of oxygen taken out by the body's tissues. So during exercise, blood flow and oxygen extraction by the muscle increases. It amplifies. So we have greater blood flow to a muscle, and more oxygen is now being taken out of the muscle. So what does this mean? We'll kind of explain it on the next slide, but think about it. Working muscle, if we're exercising, our muscles need more oxygen, especially if we're doing aerobic exercise. We know that oxygen is needed by the mitochondria to produce ATP during aerobic metabolism, and so we have to have oxygen present, and so the muscles will actually take out oxygen from the blood. And when it takes out that oxygen, it's able to use it. and allows us to keep exercising. So, and then I think that's what we'll discuss on the next slide, but let me just explain that graph at the bottom. It's basically just showing a positive linear relationship between oxygen consumption and blood flow. The more oxygen consumed contributes to greater oxygen delivery to working muscle via an increase in blood flow. All right, so let's talk about something now called AVO2 diff, or arterial venous oxygen difference. So we have our definition here, so I'll read it and then I'll explain. Amount of oxygen per 100 milliliters of arterial blood entering a tissue minus the venous blood leaving that tissue. So let's first define arterial blood. So arterial, moving away from the heart, entering into a muscle or tissue. So this is in peripheral circulation, and this blood is oxygenated. Venous blood is blood that is returning back to the heart, so it's leaving a tissue. This blood is deoxygenated. So to get AVO2 diff, you take the difference in oxygen content between the arterial and the venous blood. So this basically tells us how hard our body is working during exercise and how much oxygen our muscles are taking out of the blood passing over it. So AVO2 difference is increased during exercise. And that's talking about the difference. The difference increases because more oxygen is taken out of the blood by the active tissue. At rest, AVO2 difference is relatively stable. There's not a big difference. We'll look at the values in a second. But during exercise, the body's working harder, so it needs more oxygen. And so it's going to take more oxygen out of the blood. So when we take the difference between the oxygen in the arterial blood versus the oxygen in the venous blood, we're going to see a big difference during exercise. So the difference increases. Here's another term, but it's very similar. It's talking about the right atrium and the left ventricle, though. So now we have arterial mixed venous oxygen difference. So this is the difference, again, in O2 content between arterial blood, but now it's blood leaving the left ventricle, being pumped out of the aorta to the body, and the venous blood entering into the right atrium. So venous blood entering back into the inferior and superior vena cava. So this value here represents the difference for all body's tissues, metabolically active and inactive. So if only measuring active tissue, AVO difference would be about 19 milliliters per 100 milliliters of blood, but it takes into account both active and inactive. So let's get some numbers here. So at rest, AVO2 difference is about 5 milliliters per 100 milliliters of blood. So these values here are kind of referring to this top definition. So at rest, basically saying that the difference between oxygen content in the arterial blood and the venous blood is only about 5 milliliters. That's the difference. That's not very big, but it increases by about 3 times once we start exercising, meaning our muscles need about 30 times more or greater amount of oxygen. So during exercise, now the difference between oxygen content between arterial and venous blood is 15 milliliters. Again, the reason is the arterial blood is entering into a muscle, and that muscle is extracting oxygen. So if it's extracting oxygen, there's now going to be less blood or less oxygen in the blood flowing back to the heart. AVO2 difference represents only one aspect of oxygen delivery. It's also affected by the amount of blood flow delivered. So how much blood flow is actually being delivered to the body or to the muscles. So this picture here shows AVO2 difference in oxygen consumption during exercise. So let's kind of first break down kind of what are we looking at here. So we already know we're looking at difference in blood oxygen content between arterial blood leaving the left ventricle and venous blood entering the right atrium. So let's start over here at rest. So at rest, my oxygen consumption is very low. So I'm not consuming a ton of oxygen because I'm not exercising. We also see this difference here. So this top line will represent arterial oxygen content at the left ventricle. So this is and we said that number 19 earlier. So 19 milliliters of oxygen per 100 milliliters of blood. So we see here, this is the amount of oxygen in the blood leaving the left ventricle, so going to the body. And then this red line down here is basically looking at the difference in how it increases. So if we look 15 to about 19 to 20, we'll say that's a 5 milliliter difference. So that's the oxygen content in the left ventricle at both rest and exercise. So this blood just returned from the lungs, about to be pumped to the body. As it's coming back to the right atrium, it didn't drop off a lot of oxygen because we're not exercising. The muscles don't need a lot. So the difference we see on this right here is very small, only by about 5. But now let's look down here across the bottom. Now let's say our oxygen consumption has increased. So now we're consuming more oxygen, we're exercising harder. So now we're measuring the amount of oxygen that's returning back to the heart, or in the blood returning back to the heart, entering into the right ventricle. We see that it's deficient in oxygen because my body needed that oxygen. So it's taking the oxygen out of the blood. And we see this is the difference here, all this tan pinkish color. So the difference here is very small at rest, but as we start exercising, the difference increases. So basically looking at the O2 content that's returning back to the heart, we lost more oxygen because we were exercising. So just to kind of sum up this slide here in this lecture for today, there's an increase in AVO2 difference with exercise. The reason is we just have to deliver more oxygen to the body. Again, this bottom number here is referring to the oxygen content in the right ventricle and how that content has decreased from rest to exercise. So we said at rest the difference is only about 5 milliliters. At exercise, it's about 15 milliliters. That's because more oxygen is being taken out by the muscle. So the difference between that blood or that oxygen content is going to be greater.